Hi, this is Andrea Kane, and I am here with you for HIT 330 Health Information Technology. This is week 9. Can you believe it already? Week 9. This week we will be covering chapters 6 and 7. Chapter 6 is on data management, chapter 7 is on secondary data sources. So let's start off here. This video is on chapter 6. We are looking at course objectives still 8.1 through 8.9, and the specific unit objectives that we are focusing on this week are 9.8.1 through 9.8.6. And if you have a question as to what those specifically are, go back to your syllabus and take a look. And that's what we're really aiming for this week. All right, so let's talk about what the book wants to teach us this week. The book wants to teach us about data management. It says the definition and structure of data elements and the creation, storage, and transmission of data elements. That's data management. Organizations need to know and understand how it's produced, why certain types and formats of data are produced, and how it's stored and managed, and how to ensure its integrity. Data sources. This is where data is being generated, those locations where it's being generated and stored within an organization. It includes both clinical data and administrative data. These are some common data sources. You can see it talks about the EHR, and then other parts of this are components of the EHR. You will have a class in next fall in the HIT program called, what is it called? It's about information systems, and it's HIT 352, and we go through in detail a lot of what makes up an EHR and what are those source systems and what kind of smart peripherals are involved and all these other things that make it up. But these are pieces and parts that we're just introducing you to, because remember, HIT 330 is all about introduction. We're going to give you a little bit of everything because we're just trying to familiarize yourself with it. It's almost like doing a big painting, and we are taking your finger and having you dip it in a piece of in a particular paint, and then put that on your page. And you're doing that for this like 75 different aspects of HIM. You're just putting that fingerprint with a unique color of paint on your board. And then what we do with the subsequent classes is we come back and we build on that and we shape it. And you'll find that in the end, this is sort of like the center of your flower, but we added so much to it over time. But this was just your introduction. So that's why there's this nice long list of stuff. System characterization is the process of creating an inventory for all systems that contain data, including documenting where the data are stored, the type of data created or stored, how they're managed, and the hardware and software that they use to interact, and providing basic security measures. Data elements are a single or individual fact that represent the smallest unique subset, I'm having trouble talking, of a larger database, sometimes referred to as raw facts and figures. So an example of a data element might be a patient's age, or their gender, or a particular blood pressure reading. Data dictionary. This is a listing of all the data elements within a specific system that defines each individual data element, the standard input of the data element, and the specific data length. And data dictionaries, they can be a bear to create, and they can even be challenging to keep up with, but they are such a godsend if you've got questions about data elements. How is it going to be put in the system, and how many spaces do you have to do this, and what kinds of element, what kind of, is this going to be a drop down list? Is it going to be a radio button? Is it going to be free text? It really helps to have this data dictionary, but it can be challenging to create. So this is an example of a data dictionary. This is a really good example because it gives you the data field, it gives you the name in the system, it defines what that data field is all about, it gives you the data type, it tells you the format so you can clearly see it. It tells you the field size. How many characters is it going to be? It tells you values. It lets you know if there are limits. For instance, under census, it has to be a whole number from 1 to 999. And then it tells you what source system it's coming from, when it was first entered, and then why that item is included. So this is a really great example of a good data dictionary. This is what you want to see. Data sets are a recommended list of data elements that have been defined and uniform definitions that are specific to a type of healthcare industry. And there are data sets for inpatient care, there's data sets for ED care, there's data sets for ambulatory surgery care, and you can look these up and we'll actually cover them as we go through the program. Oh, and here they are. Here they are listed for you. So you've got some. MDS is used in long-term care. That's the main place that MDS is used for. OASIS is typically home health care. So that gives you some ideas. Databases. They're a collection of data that are organized in such a way that its contents can easily be accessed, managed, reported, and updated. Databases can be great because you can go in and you can pull multiple elements and put them in a report, and sometimes you can get many databases together in the same system and be pulling all sorts of data together. And there are types of databases: relational and object-oriented. Again, this is covered in your book. There is a life cycle to a database. Did you know that? Databases have a life cycle. When do they start and how do they end? And these are the steps that they go through. Indices, that is the plural of an index. An index is singular and indices is plural. And these are a report or a list that you get that help you understand the data that's in the database. And you use it as a guide or indicator to locate something within that database or the systems that store that data. Some common healthcare indices that you will run across. Probably the most common that you will run across is the Master Patient Index. It has patient demographic information. It's where you identify your patients. Hospitals are required to keep disease indexes, operational procedure indexes, and physician indexes. And again, these are lists of exactly what they say. Data mapping. This allows for connections between two systems. This is when you have source data and you then are mapping it to target data. A lot of times you'll see data mapping take place if let's say your healthcare organization has a Cerner EHR and someone has decided that you're going to transition from Cerner to Epic. So you're going to do a lot of data mapping before you go live, where you're going to take your source data from your Cerner system and you're going to see how it has to be mapped so that that information is readily available in the Epic system. And that's an example of data mapping. And so this gives you, this is an example of coding information. This is a data map between ICD-10-CM and SNOMED. There are mapping relationships. You can have no match, an approximate match, and an exact match. And think about your master patient index. If you don't have a match, you don't want to put those two together. You don't want to map, you don't want to put it together if it's not matching. If it's an approximate match, you may need to get some more information before you decide whether or not you're going to map that together. An exact match, you'll feel very confident about mapping it because you've got enough data to indicate it really is an exact match. Data warehousing is a collection of data from different data sources within an organization and storing it in a single database that can be used for decision making. So for instance, if you have 5 different databases and you put them all together, it's called a data warehouse. And you can go in there and then pull information from all of the different databases into one report. I have done that when I worked in quality management. And again, it's exactly what it says. And what you're doing is data mining. You're looking to find trends and correlations that you could not find if you only used a single database. But by using multiple databases in a data warehouse, you may be able to find, like I said, those trends or correlations that help you identify opportunities for improvement. Information governance is an organization-wide framework for managing information. That's really what it's all about. And each organization needs to have some form of information governance. And a lot of times health information management professionals are asked to be a part of that or even to lead it. And this just goes into information governance. AHIMA has information governance principles, and they're listed here. You can also go out to the AHIMA website and type in information governance, and they have tons of reference materials, information articles, toolkits, all sorts of stuff that you can use to help your organization with its information governance. And then this just shows you their model. And adoption level. And this goes on a little bit more about data governance. Now the other was information. Now this is specific to data. Data stewardship, data sharing. When are you doing data sharing? What are you sharing? How are you sharing it? You hope that data sharing is going on. So for instance, if you have someone who comes into registration and they give you their demographic information, you want to make sure that data is shared so that when they go to a department for a test, they're not being asked to give it the information again, that the system shared it between departments or between systems. So a good example of this would be between the master patient index and the lab information system or the radiology information system, or maybe like if you have a respiratory information system, you want that master patient index information to be shared, that data to be shared, so that you're not recreating it every time. Data integrity is critical. You have to make sure that what's entered into the system or maintained on paper are accessed and amended appropriately. And this goes through a lot of what that is. And again, I'm going to refer you back to your book for that. But we do talk about data integrity in almost every class that you will have in health information technology in the program, because it is so critical. And we do a couple of deep dives into integrity as we go through. So again, we're just touching on it here to introduce it, and we'll come back and we'll go at it from several different perspectives later. Common standards development organizations, and again, this is more things that you'll get through as the program goes on, but this is just to introduce that there are some organizations who develop common standards. They're sort of the source of developing these common standards, and they give you some examples here. Data information exchange. This allows the electronic exchange of information between electronic systems, and that's needed to support interoperability. And we will talk about interoperability again multiple times. And again, data information exchange and the fact that there are standards that support it. And we talked a little bit about these agencies that are these organizations that develop the standards. It's important to have a data strategy. How is information going to be used by the organization? How's it going to be stored? How's it going to be protected? How's it going to be available? And these are components of that. And these are all terms that are mentioned in your book that you want to go through and make sure you know. Enterprise information management. Enterprise is bigger than one organization. Well, I don't want to say organization. Facility is probably a better word. An enterprise the best example I can give you is one that I worked for. I worked for an enterprise that owned over 30 hospitals over 3 states, and they also owned long-term care facilities, ambulatory surgery centers, freestanding EDs. That was a whole enterprise. They used the same IT system, the same functionality across all of that. So they were managing the whole enterprise. All of those hospitals used the same system and had the same data elements and had, so that's what this is talking about. It's not just an individual single facility or individual single physician practice. It is the whole enterprise of everything that's a part of that. Information assets, that's information that's collected during day-to-day operations and has a value to the organization or within the organization. Data visualization and presentation, you can use tables, you can use graphs, but you need to make sure that whatever you use, it's got to be meaningful. It's got to make sense. People need to be able to look at it and understand it. It has to have enough detail, but not be so busy or overwhelming that they can't get something out of it. Critical thinking skills. Through the HIT program, critical thinking skills are pretty consistent for what we are trying to do as our primary common learning outcome. That is what we assess as you're going through the HIT program here at NICC. We want you to come out of it knowing that you have strong critical thinking skills. And that means that you're looking at the situation from multiple angles and you're able to look at all of the information. You're able to research it, you're able to read it, you're able to agree or disagree with it, you're able to support why you disagree or agree with it, and you're able to recommend future actions or identify areas where things have been missed. So that's what all critical thinking is. Data quality is ensuring that the information entered into the patient's legal medical record is reliable and has integrity in order to support patient care, patient safety, and provide evidence for reimbursement and accreditation. That's a wonderful definition for data quality. Make sure that you know that. And then AHIMA has data quality management model domains, and there are 4 of those, and they're listed here. And again, you can look at this in your book, as well as go online to AHIMA's website and take a look at the information they have about this there. And here are the model characteristics of what you want your data quality management to be. Clinical documentation. Integrity. This is a program that's designed to ensure the quality and integrity of patient data while supporting healthcare operations such as coding and reimbursement. It's called CDI, clinical documentation. It's often called clinical documentation improvement, but it's also integrity. You want to be able to get the most accurate and complete and timely information. And you want to do it at or near when the care is being given, so that by the time you get to discharge, you already have all of the documentation needed to code to the most specific level. And so what this is it looks at the documentation as it's being generated by the providers. Is the patient's severity of illness being identified? Is there any missing or conflicting or unclear documentation, and how do we get that rectified? Making sure that we're supporting appropriate code assignment and reimbursement, making sure that the record is complete, and then that caregivers are communicating, sharing education, improving quality of care. So CDI queries. This is a communication tool where you're asking the provider for clarification. So what you're doing is you're querying the doctor. You're looking at what's in the H&P, what's in the progress notes, what's in the consultation reports, what's in the operative reports. And if it's not clear what the patient's condition is, what their diagnosis is. Maybe there is, maybe the attending physician is documenting that the patient has chronic COPD. And maybe you've got a consultant who's saying that this is an acute exacerbation of chronic COPD. Since the diagnosis for an acute exacerbation of chronic COPD is different than simply having chronic COPD, and it has the potential to impact reimbursement, it needs to be clarified. And you can't just ask it outright. You can't just ask it. It has to be put in a format when you ask, using clinical information, no mention of reimbursement ever in any way, and you have to leave it open-ended. So for instance, if I were a coder and I had that case that I was just explaining to you, and what I would do is I would develop a query for the attending physician and say, in your history and physical report, you listed that the patient has chronic COPD. Upon admission, in your H&P, you also documented the patient's clinical signs and symptoms were XYZ, and you ordered the order set for acute exacerbation of COPD. Patient had a chest x-ray, it showed this. Patient was placed on this medication, which is a diuretic, or was given this inhaler or this treatment, like a respiratory therapy treatment that's known for COPD, for treatment of an acute exacerbation of COPD. And then the consultant, the pulmonologist that you had consult on the patient, also noted in their consultant report on this date that the patient had an acute exacerbation of COPD. Can you please clarify the admitting diagnosis for this patient and explain what is the severity of this patient's COPD? You want the physician to come up with what it is, to clarify, to make it clear. And that can be done on paper, it can be done electronically. But again, you cannot lead the provider to the answer. You need to use clinical information and what has already been documented in the record, not making anything up. And the query itself has to be open-ended. You can't lead, and you can have nothing in there about reimbursement of any sort. Data collection tools, you need to keep in mind screen design, whether the data is structured or unstructured. There are best practices for forms design, and there are processes for controlling forms. And again, we will talk about those in more detail, and I refer you to your book. We already talked about clinical documentation integrity, about what that process is, and coding queries, and what that's looking at for documentation. This also is talking about individual entries in the record. You want to make sure that the entries in the record are legible, that they're reliable, precise, complete, consistent, they're clear, and they have time, and they were done timely. You want everything to be documented in the medical record at or near the time of the event. That phrase needs to be branded in your brain, at or near the time of the event. That is documentation integrity. So some CDI tools include audits and queries. There are lots of ways that CDI is involved in reporting and education. Typically there's a CDI team and there are meetings, and sometimes you have a CDI physician champion that helps you with education or move things forward. And then these are some common CDI reporting areas. And yes, I've been involved with CDI too as well. Excuse me. There's education, again, that needs to take place, because Physicians go to school to treat patients. They don't go to school to learn how to document perfectly the way that we in HIM want them to document. They learn from the medical school they go to, they learn during their internship rotations, and then they learn through their residency. And there are so many residency programs across the nation. Documentation and coding and understanding all of that is not high on the list because doctors are to be doctors. They are to do patient care. And so you'll find that there's always room for educating providers. And you have to do it in such a way that it's winsome, that they want to be involved, that they see the benefit to themselves as well as to their patients, and understand that you're not asking them to do more, you're just simply asking them to do better. And anytime you can find a tool to help them do it better and more efficiently without taking more of their time, they're usually willing to get on board with it. So data management and bylaws. There are written documents that provide details and information regarding rules and regulations established by a healthcare organization to help support healthcare operations. And these can facilitate the collection and assurance of quality data. So some different kinds of bylaws that are used include provider contracts with the facility, medical staff bylaws, and hospital bylaws. And we will again be touching on all of these as we go through the program. Just please be aware of the fact that there are 3, and these are the 3 kinds, and they're just common. So what is the HIM rules in data management? We are involved in information governance, data governance, and clinical documentation integrity or improvement. And that is it for Chapter 6 on data management. I will be back shortly to talk about Chapter 7, secondary data sources, because these 2 chapters make up week 9. Hope you're doing well. Talk to you again soon. Bye.